I wanted to start with this quote: "Every system is perfectly designed to get the results it gets." I like this quote because it really speaks to the challenges that we have as a healthcare system and healthcare organizations. We work within systems that are not designed optimally to provide quality patient care for optimal outcomes. I think this quote actually describes those challenges that we face every day. The consequences of fragmented healthcare are well documented, and we know that the consequences are real and significant. With fragmented care, we see healthcare costs that are 75% higher for patients who are receiving uncoordinated care. Patients who receive uncoordinated care are 7% more likely to not receive best practices. And we also see that if we do have care that is coordinated, we do see an increase in great benefits around interprofessional collaboration, which can increase our operating margins, reduce ER visits, and reduce inpatient admissions by 50%. So we know that the consequences of fragmented care are real, and we also know that if we can impact fragmented care, we can see great benefits from that. Care coordination has been proposed as a solution to care fragmentation for patients and families. As we know, the lack of care coordination impacts this patient experience, their health outcomes, and the quality of care that they receive. There are several definitions of care coordination. I like the simple definition that was put forth by the National Quality Forum, as it addresses the key elements of patient-centered care and sharing of information across the settings as a function to ensure that patients' care preferences and needs are met. Now, I'd like to take a moment to talk about the key elements for care coordination. And they really fall into these 6 elements that I will talk about a bit more. These six elements include patient and family engagement, the use of a longitudinal plan of care, the importance of team collaboration and team-based care, the application of evidence-based practice, the optimal use of technology, and then, of course, reviewing our outcomes of care. Despite the benefits of coordinated care, healthcare leaders and organizations continue to struggle to make the necessary cultural shift in patient-centered care and team-based care and optimally use technology. We know that effective care coordination to patients is key in their care and in healthcare transformation. The current systems that we follow are very clinician-centric and not always tailored to the patient's individual needs and don't address the patient's social context, meaning their social determinants of health and health equity. To address the complexity of healthcare and the fragmentation that we experience, I'd like to share a framework-driven approach to think about how we make those cultural shifts and practice changes that need to occur to enable longitudinal care coordination. The framework that I'm going to share with you is based on the need to look at how do we transform our cultures and our practice patterns to really enable that patient-centered care. The framework supports the successful implementation of effective care coordination by first putting the patient at the center of care, by creating a healthy, healing environment for the patient and family, by promoting team-based care and interprofessional integration, and focusing on the clinician's well-being and engaging the care team in the advancement of evidence-based practice and professional practice, optimizing technology, and the application of evidence-based practice at the point of care. I want to go a bit deeper into each one of these areas. I will kick us off and then I will hand it over to my colleague, Karen. First, really looking at patient-centered care. Everything really should center around that patient as our partner and is central to really creating the environment for us to optimally care for patients. The impact of health on patients and communities, we really must shift from doing to our patients to being a partner with those patients. As a partner with those patients, we can better understand their health needs, their preferences, and their values, and focus on personalizing their care. And by understanding that patient and their story, we can identify the barriers to care and begin to put together a longitudinal care plan that addresses those needs. because understanding the patient as a whole is so important, and really understanding those items that impact their daily lives and their care. We must have a deep understanding of the social determinants of health and the impact that has on their care and their well-being. I want to go a little bit deeper on social determinants of health, and why does this matter? As we understand the patient's whole story, we also need to understand the context of their social factors in their life. We know from research and experience that as much as 50% of a patient's health care can be attributed to non-clinical factors such as social, economic, and their physical environment. The social determinants of health fall into five domains according to Healthy Population 2030. These domains include economic stability, education access and quality of education, healthcare access and the quality, the neighborhoods and environments they live in, and then their social and community context. We know that social determinants of health contribute to several health disparities and inequities. For example, people who don't have access to healthy food, to grocery stores, live in food deserts, are likely to have poor nutrition. And we know that poor nutrition leads to a number of health outcomes like heart disease, diabetes, and obesity. And the Kaiser Foundation brief, it was shown that just food insecurity can relate to $155 billion in extra health costs annually. We also know that there's a clear association between inequities in health and social determinants of health. The Future of Nursing 2020-2030 report really focuses on what we can do as nurses and interprofessional leaders to make a difference in this area. We have the opportunity to really be positioned well to think about how we can really focus on care management and care coordination to impact and improve health equity across the population. It is a very important area for us to focus on, and one that we currently have some barriers to actually operationalizing related to scope of practice and practicing at top of license. So it is a challenge for us as healthcare leaders to think about how we can remove those barriers and really work towards improving care coordination and how we impact health equity. Another key component to successful care coordination, of course, is having an effective care plan. So I wanted to start with the definition of longitudinal care plan from Dykes et al. A longitudinal care plan is a holistic, dynamic, and integrated plan that documents important disease prevention and treatment goals. The longitudinal care plan, as we had mentioned, to be patient-centered, reflects the patient's values, preferences, and enables bilateral or bidirectional communication between the care team. It is central to care coordination. The care plan really should be the hub for all the sharing of information with the patient and with the care team. As noted in this definition, it needs to be holistic and address the patient's goals and preferences and what's important to them. We should really have the patient being a partner in this care plan. It should be mutually determined with the patient, not something we're doing to the patient, but partnering with them. Again, it needs to be accessible to the patient and to the care team so that they can work together in the development and implementation of that plan. We know that a longitudinal care plan can benefit the patient and the care team by engaging the patient as an active partner and knowing that the understands their unique needs and that there is a plan in place for them. And the clinicians benefit, of course, from having the interprofessional team all working from a central care plan and contributing to that patient's care plan. Again, just to summarize, for maximal impact, we need to ensure that that longitudinal care plan is set up in a way that it is a one-stop place for us to look at the patient's personalized care plan, that we are, again, partnering with the patient, that we are bringing in and focusing on the identification of social determinants of health, that we're integrating their social care needs into their care plan, that we do work as an interprofessional team to share and communicate, and very importantly, it needs to be focused and built into our clinical workflows on a daily basis.